Dr. Ari Malavi. We want to thank you to High Def Academy. Today's topic has been dealing with skin excess. We've kind of defined what skin excess is, some of the definitions that I've come up with in the past, that you really have to look at skin three-dimensionally. It could be excess in the horizontal plane, what I like to say redundant, versus in the vertical plane or perpendicular, where you can pull it away, it's elastic. It's more of a looseness, elasticity. And there's texture issues, but we met with Dr. Masudi earlier, and we talked a little bit. And today we have the honor of having Dr. Babak Moeen here. He's considered one of the great cosmetic surgeons in the Los Angeles area, and we wanted to kind of shoot the topic with him and see how he approaches skin excess and extra, and what are his favorite treatment modalities.
Thank you for having me. My perspective about skin laxity is very similar to Dr. Masudi's perspective, but I have a little bit more tools in my armamentarium in terms of how I approach it. And the general concept is the same. I think we all struggle with the concept of excess skin and the laxity and redundancy. And as we get older, we have a lot more redundancy, and we approach the threshold of having to undergo surgery. But many people are reluctant about having surgery, and they find surgery as the sort of the end game. We try to make this a more acceptable transition by providing tools and that bridge the gap between the surgical approach and the non-invasive approach. And throughout the past few years, we have had multiple RF modalities that have helped. But the challenge of figuring out what's the best RF modality has been upon us because some of these devices come and they're very expensive for us surgeons to purchase, and we have to be honest with our patients. And I find it very challenging to have a genuine conversation and explain it to my patient that just because a device is advertised heavily by various different companies, it doesn't mean that device is to their benefit. And as a surgeon who invests in these devices, I can tell you I've spent well over $200,000 to $300,000 on these devices. But if I don't see good effect in a device and I don't see significant improvement for my patients, I will take that loss and I won't use that device on my patients. So the honesty and integrity of using devices appropriately is part of the decision making of providing a service for a patient. When I say this, I want to bring to your attention what that means for us surgeons. And as surgeons, doctors in the cosmetic world, we have to be careful to when we provide the service to see the effect. And what excites us is the new device called Ativa has been shown great promise and really amazing results in a short period of time, and that truly excites us and makes us want to use that device. And as surgeons and as folks who are interested in improving people's appearance and their overall well-being, because it's not all appearance. When you improve somebody's facial laxity and their aura changes too. So
can you kind of describe to us what your approach is? Like, is there an age criteria or a severity of laxity or redundancy that's going to push you one way or the other?
Certainly. My approach is first a thorough evaluation of multiple different layers, and I look at it as the skin layer. I look at the skin consistency, the texture, the color, the age and fine lines, wrinkles, the dyschromias of the skin. and then I look at the level of fat and hollowness and loss of the overall tissue volume, and then hollowness of the bony structure of the face, and then I go over the laxity and try to assess how much laxity we are dealing with. Age is certainly an important criteria, but age, as we all know, is a marker that is sometimes not consistent. And but what's important is really examination. We examine the face by feeling the tissue. We examine the face by looking at the different levels of its fullness, and then make a decision on what's appropriate. In a young person who has minimal lines and wrinkles, they may just benefit from some IPL therapy, some regular microneedling, and good skincare. And somebody who has who starts developing nasolabial lines and some hollowness in their mid-face, they may need filler or fat grafting. And then we start approaching the problematic things like jowling, marionette lines, and significant mild laxity in the face. And then we start looking at the radiofrequency modalities to tighten the skin. One of our favorite systems is Renuvion J Plasma, and this technology has really been groundbreaking for skin tightness. And although we just recently got the FDA approval cleared to allow for using it in that type of language, but we have been using this technology for many years with great results in body surgery, and we see how the Renuvion technology causes the fibroceptal network tightening, and that decreases the skin laxity and elasticity. That decreases the skin laxity and improves the elasticity of the skin, bringing the skin much closer to the muscle layer and the fascial layer underneath. And that has significant groundbreaking. That was a significant groundbreaking technology that came to plastic surgery and cosmetic surgery.
Can you to clarify for everybody out there? So what's the difference between the Renuvion radiofrequency and like the external radiofrequency, so everyone's clear?
Yeah, so there is multiple external radiofrequency, whether it's bipolar, multipolar external radiofrequency, but all these technologies have a limit in what they can deliver in terms of energy and heat. And most importantly, because the skin surface gets heated up, and the skin surface can only tolerate so much heat before somebody starts hurting significantly. Those modalities that use the skin surface to heat up, they are unable to deliver enough energy to cause the significant changes in the molecular conformation of the proteins and the subcutaneous tissue to stimulate a regenerative effort in the fibroceptal network. And the Renuvion technology goes directly under the skin and is able to heat up the fibroceptal network and create a micro injury to that level of the skin, which is deep within the subcutaneous element of the skin, and that invigorates and causes regenerative properties by stimulating the collagen production, elastin production, and bringing stem cells to restructure the network of skin elements.
So you briefly mentioned Ativa, and so did Dr. Masudi. So I'm sorry. So what's the difference between like Ativa and Renuvion? What are we talking?
So One of the problems with Renuvion is in order to use Renuvion, you need to create a space because Renuvion works through transfer of energy through plasma, uh, uh, plasma energy, and that requires inert gas that is uh, the medium for transfer. And in order to get that, you need to do liposuction and you need to open up that space with the gas. That change also has some repercussions. One is there is some level of fat loss when you do that. The second problem is you also release a lot of these fibroceptal networks in order to create new septate, and that by itself requires a lot more surgical intervention and is more invasive. The Tiva, although it has the same type of frequency and same range as Renuvion, and they have actually expanded that energy profile, they are able to, we are able to deliver that energy with the probe without putting gas underneath the tissue, without the need to do liposuction and opening up the matrix. So it's a lot less invasive and it's a lot more efficient and can be done in the essentially in the clinic versus in the OR where you need a significant amount of anesthetic, and so it makes it an outpatient procedure, and that drops the price significantly for our patients. And we certainly don't like to waste our patients' money, and we want to be able to deliver maximum amount of effect and result for our patients without subjecting our patients to excessive amount of energy that can cause burns and other.
Can you maybe comment also on the physical constraints? Isn't the Renuvion probe bigger, thicker than?
Yeah, the Renuvion probe is bigger and thicker, and
is it conducive to treating the eyes and the forehead and the cheeks?
Exactly, and that's a problem, and also especially in the small environment of the skin, the small skin envelope in the upper eyelid and in the forehead area, it's really, you can't use the Renuvion. The neck is the most common place that we use Renuvion, but it's the Tiva can be used even for the neck in the submental area effectively by just numbing it, minimal anesthetic, and using some nitrous, which is laughing gas, and allow our patients to have a pain-free experience.
Okay, so break this down for us. Where do you draw the line? Who's going to get the Tiva? Who's going to get your traditional face stuff that I'd like to talk to you a little bit about? I know your time is very limited, but for our patients that are in the 35 to 40 category, age category, who have beginning to see nasolabial folds, they're beginning to see touch of jowling, who have minimal laxity, those young patients are excellent patients to get a Tiva. Once you start having a moderate amount of laxity in your neck area, we start looking at options such as doing Renuvion, J-plasma, and if the patient needs facial work, then a Tiva would be more favored for that patient, especially if we're trying to keep this in an outpatient setting. We love a Tiva as an outpatient procedure to be able to combine that with other outpatient procedures such as fat grafting or fillers and Botox in the same setting at the same clinical time, and to provide our patients with a non-invasive experience. So we've covered the minimally invasive. Can you tell us a little bit, and I'm sure we'll have more sessions on this, but so who's going to get the traditional face and neck lift, and what's your approach to that?
My approach to providing traditional face and neck lift is typically on a patient who is both mentally ready for change and physically fit to undergo the surgery. And I am relatively aggressive in um, in recommending a facelift for people who are in their appropriate age. And I stand firm with this because I believe a lot of people wait too long to have their facelifts. And my rationale behind when to have a facelift is very clear. It doesn't make a lot of sense for people to wait until they're 70 something years old to undergo their facelift, because a facelift in your 70s is not going to be a sustainable facelift. It's not going to last as long for you, and the effects are not going to be as impressive as a facelift in your 40s and 50s are going to be. Certainly, if somebody doesn't need it, they don't need it. But when somebody in their, let's say, at the age of 45 undergoes a facelift, they truly look 10 years younger. And you can easily mask the effects of aging by having a facelift at a younger age versus waiting until you have changes in your face that are not repaired by a facelift. For instance, as people get older, there is changes in the size of their nose, in the hollowness of their eyes, in the problems with their bone structure in their face that you can't repair with doing a facelift. So the younger you gain the benefits of a facelift, the more time you have to be able to enjoy it. This goes also for things like Ativa, starting these things at a younger age group in a time where somebody actually starts having suffering from some of these changes versus waiting. And we see this very commonly where people wait until they're in their mid 50s before they come in for these non-invasive treatments. And at that time, they actually need a facelift rather than having those non-invasive procedures done. And then there's a subgroup of patients that are no longer a surgical candidate, and they can't benefit from surgery because of various different reasons. Either they become physically unsuitable for a general anesthetic, or overall it'll be too much for them to undergo such a change. And those patients would benefit from the non-invasive at older age. And although the effects are not as pronounced, but they're still visible, and in the right patient, it can help them tremendously.
So you're going on record here and saying, in your opinion, if you're going to have cosmetic surgery, it's beneficial to have it earlier than later, right?
Certainly, I'm not insinuating that people need to have their cosmetic surgery in their teens, but what I'm trying to say is a lack of public education about when it's appropriate. And I think there is a big reluctance of, people are having too much cosmetic surgery and it's not appropriate. Yes, certainly there is a time and a place for everything. And we have to be sensitive, and we have to embrace our age and embrace our time in an appropriate manner. But delaying things that truly weigh on you and cause people to have a significant social anxiety about how they look, that can be fixed, need to be fixed, instead of waiting and letting that damage them interpersonally and emotionally, and where it can be fixed and they can gain the benefits, reap the benefits much earlier.
I mean, so psychosocially, I agree with you, but you're saying that structurally, right? Physically, the effects of surgery and outcomes are better when they're done a little bit younger than a little bit older. Is that
Absolutely,
correct?
that's my opinion. I see the difference. The skin of somebody who's significantly older does not even it becomes like paper. It fractures even when you do a facelift. You pull, doesn't matter how tight you pull that SMAS or the skin, and you create that structure. You're not going to be able to have a sustainable result when somebody is significantly older, and that those are the bad facelifts that people see, and they look and they see like somebody's face looks deformed and abnormal. It's just the wrong time to do that surgery, and unfortunately, this understanding and this education comes very late in some people's career.
And then let's just finish off today. I think I want to also have you come back. I want to talk to you about your approach to facelifts. Again, talking about the High Def Academy and how we approach tissue planes and multiple layers. I'd really like to know about how you approach your facelifts. I presume you don't do a skin only, right? You do a SMAS facelift.
Absolutely, we do a SMAS facelift. That's our approach, and we make sure that we have very strong SMAS undermining to allow what's referred to as a deep plane facelift, to make sure that our suture line and the face is lifted in an appropriate manner to ensure proper vectors of the face to emulate the youth and beauty of the nice oval face.
Fantastic. We would love to come back and have a full-on discussion and session on facelifts and how you approach them in the future. And I always ask all my guests, is it okay if we come and do an on-site visit and see your magic at work sometime?
Absolutely.
Fantastic. And there you have it, guys. Today's topic was skin excess and how we approach it. We've had wonderful guests. I want to thank Dr. Moeen for coming here, and we look forward to see you next. Thank you.
Thank you.